Good afternoon, everyone, and thank you for joining us for today's webinar, Ways to Develop Staff Leadership. My name is Rachel Logan, the Training and Technical Assistance Manager at the National Center for Health and Public Housing. We are joined today by Karen Williams, our Director of Health and Family Services at North American Management. At the National Center for Health and Public Housing, we are supported in part by a national cooperative agreement through HRSA to provide free forms of training and technical assistance to health center programs such as webinars, monographs, toolkits, and other informative resources. Today's webinar, we will be featuring ways staff can be trained to perform better at their jobs. We will also enable participants to explain what motivates staff to take the lead on various projects and enable participants to list ways in which health centers can decrease staff turnover. Before I turn the webinar over to Karen, I will give her brief introduction and bio. So Karen Williams has over 20 years of experience managing diverse healthcare program operations, such as primary care to public housing residents, homeless health care, school health, mobile health services, behavioral health and primary care integration, and many other at-risk initiatives. Currently, she works as the Director of the Health and Family Services Division of North American Management. Most recently, Williams served as Vice President of Special Populations with Family Health Centers of Georgia, a public housing primary care grantee. As the VP Special Populations, Ms. Williams managed all federal government programming guidance regulations, including the development, management, and execution of diverse public health prevention and primary care programs. Ms. Williams is also an adjunct professor of Morehouse School Master Public Health Program. She received a BS in Biology and Chemistry from the University of North Carolina, Chapel Hill, and a Master in Healthcare Policy from Mercer University Health Policy. I would also like to remind all attendees that the webinar will be recorded and made available to everyone after the webinar and also emailed to each registered attendee. Karen, it's all yours.
Oh, thank you. Thank you, Rachel. Good afternoon, everyone. Would like to share with you a little bit of experience from the grassroots, from ground roots, from a grantee where I still share time with the Family Health Centers of Georgia in Atlanta with, as Rachel read a little bit of the bio, have been providing primary care services to public housing residents for going on 23 years now, as well as some other special populations, including school-based, mobile health, and some homeless care. So today's conversation will be about ways to train staff for better performance. And as we know, there are many theorists out there on how to motivate, how to gauge the ability. So I hope that throughout this conversation you'll have some takeaways with some really tangible tools that we've gleaned and I have used at the community health center level, as well as some management theories that we've kind of put in place. So I'd like to share a little bit with you on that. Organizational chart. That's really the first, and as we know, there are many ways to have an organizational chart, but an organizational chart is fundamental, whether it's a functional chart or strictly for the entire organization. Now, organizations vary. They can be flat lines so that it's more horizontal than it is vertical, but the idea of having an organizational chart or even a functional chart is to glean some clarity for both staff and as well as the overall structure of the organization, kind of who is who and what tasks there are that are being performed. A little quote there from Peter Drucker, who's known as one of the management gurus, that is so true and resonates with me, that rank does not confer privilege or give power, it imposes responsibility. So really there's responsibility at every level. So we want to make sure that along with the responsibility, or shall I say accountability, there is a responsibility for each of the staff persons that have been designated for any of those slots that you have on your organizational chart. Now, and we're going through this bearing in mind that the topic is performance, that we're looking to have better performance out of our staff, and thus as better performance out of our staff, where the organization itself will be more sound in the operations, in partnerships, and in all aspects of the healthcare delivery model. And organizational chart and vision, goals, and objectives are the cornerstones of making sure that that clarity is there for all staff that are involved, as well as our engagement, both external as well as internal. So then if we say, is the mission of your health center realized by all staff? Then you want to know, how do you know this? You want to ask the question, and then as you start to ask the questions to all of these areas of the mission, the goal setting, and does every team member feel like they have a purpose? So then after you answer those questions, there are some tools that can be used to help you realize whether or not the answer to those questions is yes or no. Just a few of those tools that come to mind are strategic retreats, which have proved very valuable in that whether it's a strategic retreat of your senior management, middle management, or even if it's departmental meetings or a retreat, or if there's a retreat that involves senior management and your board, there is information that will resonate from those sounding boards or these tools that are used as you craft your vision, goals, objectives, values, and mission. There's a buy-in that you're getting from all of those who are attended. So if there's some buy-in from all of those attending with those tools, be it departmental meetings, be it strategic retreat, or what have you, there's a buy-in from those who are present in crafting what the organization will look like, and those ultimately are the drivers for your organization, where you're going, where you've been. Looking at an environmental scan, and even many do SWOT analysis, strength, weakness, opportunities, and threats. And that also can be not just external, but internal as well. What are some opportunities and what are some threats that you have internally? But it kind of gets swept under the rug unless there's an active, not a passive, but an active opportunity to discover those things from all aspects, or shall I say all levels and all departments, not just only your top senior management, because that's one set of lens, but there's another set of lens throughout your organization that you have an opportunity to tap into that will really help to shape and be a bridge and a liaison to your entire operation. Even thinking about and looking at outreach, who are engaged with many of your external partners, and how that external partner has a relationship with your vision, goals, and objectives. So it's not just insular or working in silo, but taking in consideration how do I grow and how do I fit with the partners that are external, prove to be most valuable in setting the cornerstone of your vision, goals, and objectives. And I have a little link here at the bottom. Many have heard of Lean Six Sigma, which has some really wonderful ways to promote efficiency for an organization, but also taking in consideration of what the culture is of your organization, as well as how you've developed your goals and objectives and vision for your organization. Okay, so we've laid the cornerstone, and we've gone through the exercise of involving the entire organization, all staff at some level, in some type of forum. Now, how do we assess the problem? And bearing in mind we're still trying to garner excellence, performance excellence from the staff that we've hired, that we think have the skill set to do the job at hand, that will move our organizations forward, that will provide the quality of care to our patients that we're mandated and chartered to provide. So if we're digging and peeling the onion layer by layer, and we're trying to assess the problem, we're looking at in order to get performance, we're looking at ability and motivation. Motivation being the effort, the actual where the rubber meets the road, who's doing what. And so the ability is, does that staff person have the aptitude? And if they do have the aptitude, how do we keep them fresh? There's training and there's resources. And then when we look at the motivation, motivation being desire and commitment, but not only from the employee, the staff person that we have, but the desire and commitment from the organization. The organization is a living and breathing entity, of which not only is it one way with staff having a commitment to the organization, but the organization having a commitment to the staff. And there are many things that go into that. Loyalty that the organization has demonstrated with staff, so that it's reciprocated. So then if we're assessing a problem, and then we've got to balance the scales of whether with our staff if it's ability, or if it's that there's a lack of motivation, or perhaps on the organization end there's a lack of training or resources that's needed. But we're assessing the problem that will match with those goals and objectives in the organization, making sure that we've got the right people in the right places and looking at the skill sets that each one carries. Now that's a huge task, but if we divide it up into departmental and managers who we've entrusted to carry out those tasks, we don't want it to lie dormant, but we certainly want to make sure that staff or managers are in place to lead and guide the staff that we've entrusted them with. You know, it's been said that many times when staff turnover or staff leave an organization, they're not leaving the organization or the mission of the organization, but they're leaving because of a person, of a manager. So we want to make sure that everyone from top to bottom and bottom to top is well equipped with people skills and the aptitude and the skill set to carry out the job and the function. And you can find a little bit more information about this on developing management skills, as you see at the bottom of the slide there, who has a very well identified roadmap on identifying abilities. Conducting surveys are really essential that you want to look at. And I suggest this both pre and post and even mid. Pre being initially when you hire a staff, bring a new staff on board, that they actually, or to see where there may be weaknesses with skill sets that you need to have accomplished through the organization and the skill set that the individual brings. So by doing staff surveys, you're well able to ascertain training that may be needed, if there's an inherent skill set match that has occurred for the job responsibility. You may even find out if there are rewards that are distributed fairly on the basis of performance. And rewards are often congruent with actions and desired results. And taking that a little step further, we want to make sure that we continue to match our employees with a performance or task that is being done with the praise and the expectation of the organization that this is a job well done. And this is a rating scale, and you may develop your survey using these examples, 1 through 6 here, and rate them and see where your employee or staff falls on this scale. And it chooses or it seeks to help identify where a staff person may be best utilized. For example, you may have someone that's hired to be on your front desk, intake, customer service, and you may find out through a survey that actually this staff person would be better suited for your finance in billing or coding or something of that nature. So it really helps to have an opportunity to ascertain where is the best fit for your staff person. Now we look at what motivates a staff. And we know as staff are individual people, just as we all are. So there are different motivation factors that impact an employee or a staff person to agree with the staff organization and be efficient and productive, or the opposite. So if we look at the match method, have we matched the appropriate staff person with the appropriate task? We oftentimes know that personality or job or environment play a factor on the match. Whether the skill set is there or not, there are other factors that go into that. So then we look at how well there's a match between the individual doing the task and what the output is needed from the organization. Other things that motivate maybe special projects. Finding those individuals who take ownership in other aspects of the organization. The job tasks may be outreach, but we find that an individual has a real passion or a knack for helping to bring together social events in the organization. Say it's holiday parties, or say it's a fundraiser, but utilizing whatever special passion or desires that a staff may have in special projects helps to improve the task at hand that staff person has been identified for. And then rotation. Oftentimes we get a little burnout doing the same old thing every day, and depending upon what job role that is. Working in a community health center, we're the safety net for those who are ill, and oftentimes our patients bring in illness with tone, or that they're not feeling well, and perhaps the person on the front desk may get a little burnt out from having to deal with that on a daily basis every day. So cross-training is a wonderful idea. To do that, cross-training, whether it be with intake, outreach, maybe it's ambassadors in the community that you have, but whatever that position may be, if there's an opportunity to rotate so that there's enough freshness and newness to keep the staff person from feeling burnt out. Other things that motivate staff are giving back. Many who work in community health centers as the safety net have a real deep passion for the underserved and being that safety net. So it's oftentimes, if we can tap into the give back, perhaps it's give back in the sense of organizing a fundraiser, if it's a walk-a-thon, or if it's a jump rope-a-thon, or whatever it may be that gives back to the community in addition to what they're doing on a daily basis, brings freshness and newness and helps to keep staff motivated. And there again at the bottom, I've identified a resource that you may be able to look into to find additional tools. Mentorship is another wonderful way of motivating. Leaders don't just create followers, they create more leaders, meaning that we're always looking to build our staff up. You know, there's a learning curve when we have to rehire and retrain staff. So the best way for efficiency and productivity is that we train and give the most to the staff that we have, who are willing and able, that we can get the most out of. So mentorship, matching staff with peers who are excelling. Those who are doing an exceptional job, or really have a knack for what they're doing, what their tasks are at hand, and matching them or pairing them with other staff to help them to understand the rhythm of productivity. You know, there was a time when there were collaboratives. There were, HRSA provided collaboratives, for example, on re-engineering. And I remember re-engineering often looked at the physical structure of how we could get the most, get our patients in, get our patients out. But we also want to make sure that the matching there are some nuances other than just the strict 1, 2, 3 of the job task. But there may be an easier way that a staff person who's excelling at this re-engineering or becoming more efficient has something to share with another staff person who hasn't quite figured out the nuance of the job description, so to speak. And of that, there are benefits that come from that. There's an increased accountability. So then you are now not only looking at one staff person who's excelling, but now you have the synergy of a second staff person to bring them up. So that there's an accountability. There's also relationships, stronger relationships that are built. And I say this with a caveat that we're not looking at individualism, but we're looking at team, so that there's a team approach into doing this, so that the relationships bond is strengthened or developed. So there's a greater sense of unity in the entire organization that seems to catch throughout the organization. And it also provides guidance and direction by doing it this way. We often, on the previous slide, we talked about pre, post, and midterm, mid appraisals. But if we have a matching with peer, it kind of assures those milestones that we've put in place that we need for that job task to have, that it will be at least identified on a daily basis. Or if you have not decided to do it daily, if it's weekly or monthly, but at least it becomes fresh what those milestone or task expectations are. So then in our assessing the challenges, we also want to look at the ability. And in the previous slides, we talked about aptitude, training, and resources. We want to make sure that in the most cost-effective manner, we're able to give our staff those tools and those resources that are needed for them to really be the best at what they do. We want our staff to remain, and I use this word fresh, and I've said it before, it's fresh in the sense that we know what's going on. We're with the latest trends. We're not stuck in a time warp where we're doing the same thing the same old way, and thus we're getting the same old results. We want some new results. So that only comes about by having our staff the bar raised high. So that's continuing education units. That's for all staff, whether it's community health worker, whether it's our physicians, whether it's our nurses, and even our administrative staff. What's the latest software? What's the latest technology? Those are things that we want to be mindful that in order to be efficient, we also have to put something into the training of the staff that we have. And it can be as simple and low cost as brown bag chat and choose, where we have someone from the outside come in and talk about a hot topic during lunchtime, where we bring our lunch. But we're being exposed and made aware of something that's new, whether it's a new vaccine that's come on board, whether it's or shall I say a new virus that's hitting our airways, but being made aware whatever the latest topics are. And then of course our state organizations are a really wonderful low-cost way of finding out what's happening in the healthcare arena with policy changes or service delivery changes, or even our EHR, what are some things that we can get from our electronic health record. And then of course our trade organizations that offer training and technical assistance, whether it's through webinars or whether it's through conference call or email blasts, newsletters, but employing some tool that meets your budget so that you are continuing to feed and nurturing the staff that you've brought on board. So then after we've looked at the ability and make sure that the ability is up to par, motivation, that's desire and commitment. And I think I prefaced early on that it's a two-way street, not just the desire and commitment of the staff or employee, but the desire and commitment of the organization. How committed is the organization, and the organization being our managers and senior leaders, to the growth and the motivation of our employees. And oftentimes clarity on both ends, clarity for staff persons and clarity for the organization. When particular meetings will occur, who's responsible for what roles and responsibilities do we each have, and so that there's no cross area or crossing over. One employee may feel like, well, I thought that was that person's task or job. I wasn't sure where the line of demarcation was for me. Those things, when there's clarity, that helps with the motivation, because you're very clear in understanding what my role is, how I fit in, and if I understand how I fit in by my roles and responsibilities, then I can also fit into, as we saw early in the earlier slides, the goals and objectives of the organization. But clarity and tools for the task and flexibility, understanding that each staff person is unique and may approach a task in a different way, but we're looking at the outcomes. We're looking at the productivity of number of patients per day, that equal patients per month, and then annually, how fiscally sound we are, if we are able to code for reimbursement, which goes to our bottom line. So it really becomes a continuum of motivating, both from the organization and from the staff person. Okay, how do we increase morale? You know, oftentimes you may hear someone say, well, I'm not happy. This job isn't fulfilling for me, or isn't happy. So then, as the leader or a manager of an organization, we're to differentiate between happiness and morale. Happiness we really can't do a lot about, because that's the individual. The little quote here that says, success is getting what you want, happiness is getting what you get. So in essence, we're wanting to put those things in place so that there is a positive morale throughout our organization for the staff and employees that we have, and thus happiness will follow based upon the individual. But ways that you can do to improve the morale are incentives. Not everyone is governed by increase in salary, though, you know, we want to make sure we're in line with that. But it's not always money. It may be other things, other incentives. Perhaps it's flexibility. I can come in earlier one day and leave earlier on the next day. Or perhaps incentives are acknowledging a job well done, or an anniversary of having worked at this site or on this project for X amount of time. Incentives that can be as nominal as a gift card of $10 to a movie theater, or it could be a parking space for a week that's closest to the building, or if it's public transportation, tokens, or a ticket for a month, whatever that incentive is. So it's not always monetary driven, or it may be a shout out over the intercom one day for an employee that's done a great job, or a department. Oftentimes we're contingent on an entire department. It's not just only an individual. However, it's often good to be acknowledged as an individual. It can even be a handwritten note from the manager, or even from the CEO, acknowledging of a task or a job well done, or something exceptional that has happened. And this occurs through morale, both internal and external. When I say external, I'm thinking of partnerships. Many staff persons, if their task job is at a desk all day, they may not get to experience things that are happening externally that impact internal operations. For example, meetings that are held outside with other partner organizations, or if there is a dinner from a partner organization where they're recognizing the organization. But having other staff person be able to avail themselves to the total picture of the organization increases morale, because you feel like you're a part of. And shareholder, not just in the sense of money, but shared points, that you share in the vision. You become a shareholder and you hold the organization's best interests. Healthy benchmarks. We often hear about benchmarks for quality health indicators. Well, there are healthy benchmarks for an organization, and we want to reward accordingly. We want to reward staff who meet requirements, but there again, I say not only individual, but departments, because oftentimes there are other extenuating factors for a particular staff person meeting a benchmark, meaning that they're dependent upon their whole team, their whole department team. For example, correct data collection. If there's surveys that are being conducted and you need information, for example, zip code areas or census tract, from making sure those are filled out on intake, or even if it's billing and coding, make sure that the information is corrected, that's collected is corrected. Proper assessment of patients when they come in, or is there documentation so that when audits occur that all charts or systems are complete, and conduct timely follow-up, meaning that tasks are done and well done, and it's not until a year later that it's recognized. We want to have motivation or healthy benchmarks in place so that the reward is timely with the act. And these are just a few. There are many that have occurred throughout the organization where we're able to isolate an area that we're looking at to improve. So then what hands touch that area so that we can motivate them to do an even better job. So then we also look at networking, assist employees with social and professional networks. So that there again, you're growing your own. You know, there's a term of make versus buy. So then if we already have staff in place, then we have an investment in them. And there's that learning curve that if we have to have a new person come in every 6 months, we lose the momentum with outcome of productivity. So another method of getting the best performance from our staff is networking. Make sure that both socially and professional networks, that there are opportunities to grow, and foster collaborations with organizations and partnerships externally. Not always does it cost to send staff persons to conferences. There are oftentimes our partners in the community conduct workshops that are at no or low cost that still nurture and feed even the networking opportunities for our staff. Leaving room for ideas. I can't say enough about that. Ideas come from all aspects of our staff, both vertical and horizontal in sharing of information. And so then there's some benefit or outcomes to that, and that's quality improvements of the services and programs that we're running. New programs that may offer a revenue generating stream, but as we listen to our staff for new and creative ideas of what we are mandated to do, which is to be a safety net, we're looking for creative ways to do that, and oftentimes that may not come from our board meetings that we have, but it comes from the staff who are actually doing the task on a daily basis, such as how to build a better mousetrap. You know, I know this is the outcome, but there's really an easier way to get more individuals to sign up for health screenings that we're trying to do, whether it's mammograms or pap smears in the community that we're trying to get individuals to come in and participate with. So, you know, is it location? Is it the right person? But we're wanting to leave room for other ideas for development of the entire organization. Then, as we say, the exit survey, or shall I say the interview, those staff persons that leave for other opportunities to better improve them professionally, we want to know what is it that we can do to improve the process. And we want to really gleam and be like a sponge and get everything that we can from those employees that are leaving to go elsewhere professionally. What are some things that they have realized or that they would like to have occurred differently, whether it be with the environment, say desk phone or computer, whatever tools that weren't working that may have prevented them from going further in their job task. Those are kind of things that we really want to hear when we have a staff person that is exiting our organization. So we also want to be mindful as we go into the question and answer session that there are multifaceted ways for employee performance to increase, but it begins with clarity and it begins with understanding and feeling a part of the organization. So I hope that this has given you just a little bit of food to think about as you go to assess your own organization and how you line up with your vision, goals, mission of your organization with the individuals that you have working in particular tasks. So at this point, I'll turn it over to Q&A for Rachel to handle. But thank you. It's been a pleasure in sharing these thoughts with you.
Thank you so much, Karen, for your presentation. You gave us a lot of information to consider, a lot of information for health centers to consider as they continue to grow and expand and include more staff and kind of reorganize their health centers and figure out ways to increase morale and, as you said, decrease staff turnover. So now we're going to go ahead and open up the Q&A portion of the session. If you would like to ask the presenter a question, please type into your control panel, in the little box in your control panel, your question, and I will get that over to Karen. In the meantime, while I'm waiting for questions to fill up in the queue, I have just a few announcements to make. Karen had resources throughout her slides, and so I recommend that you all check those resources out, as well as check out our website for more information about upcoming webinars, monographs, and other materials that will assist you in health center management. I would also like to announce that we have recently redesigned our website. It's more functional, it's a little bit cleaner and neater and more organized, and it looks very nice, so I hope that you all just take out the time to check out nchph.org. As well as consider joining our mailing list. You can sign up through our website for updates from HRSA, as well as funding opportunities, and as I said, upcoming events and webinars. Also consider following us on Twitter. Throughout the webinar, I was tweeting about some of those points that Karen was making that were so good, especially about staff motivation and such. For our upcoming symposium, we already have a hashtag that we're using, #PHPC 2014. So I encourage you all to follow us on Twitter, as well as include us in any tweets, especially if you will be attending our upcoming symposium. And then that leads me to the upcoming symposium, which is June 10th through 12th in Alexandria, Virginia. We will be having a spring break discount for the 4 days of this spring break Easter holiday. So look forward to seeing information about that in order to save 20% off. And we also will be having our 4th annual H. Jack Geiger Award, which honors health centers and, including now this year, individuals who exemplify some of the qualities H. Jack Geiger did when he first started opening health centers. So click on that link for more information about how to nominate either your staff, yourself, or your organization for that award. And if you pay for the Public Housing Symposium, you are able to attend the Aging Symposium for free. The Aging Symposium will be held June 9th, which is the day before the Public Housing Symposium in Alexandria, Virginia at the Westin Alexandria. And in order to contact Karen for more information about ways to manage staff at PHPCs or at health centers in general, please feel free to contact her at the email shown here, as well as any of the other staff about information and training and technical support. So I'll go ahead and open up the Q&A. Are there any training modules available to train staff that you know of that have been effective in health centers?
Well, I know the big buzz has been late, and there are many colleges and universities around that offer that many of us at our staff have participated in is Lean Six Sigma. Though that may be moderately cost, there are still other opportunities for tools that we're trying to look for streamlining an organization and becoming most efficient. As I mentioned, colleges and universities often offer training around this area. Of course, we here at North American Management offer training in technical assistance around that area. But look around, even at your Chamber of Commerce, there's usually training around in your community for development as well. Yes, I would suggest looking around at colleges and universities in your area, Chamber of Commerce, and of course we here at NAM can offer that to you as well.
Okay, thank you. And how often do you recommend health centers assess staff for, you know, the aptitude that you spoke of or the desire, needs, and such?
Well, of course, your human resource will say definitely annually, but even benchmarks mid-year, 6 months is a very good indicator just to make sure that things are on track so that you're not waiting a full year to assess the task at hand, and that you're getting feedback from your staff person along the way. And then also, if you look at organizationally, it's been said for strategic planning to occur at least every 3 years, even if you're changing the landscape of your environment. It changes quickly. So within the in a 3-year span, both internally and externally, things have just, in the health delivery world, things have just been happening in warp speed very quickly. So for an organization, you want to make sure that you're on top, not find out later in a 5-year plan, a strategic plan, that there's a proposed organization or facility that's being built in your door, or that your changing demographics in your target area has changed. So you want to look at it both internally and externally. And 3 years may be a little long, but that if you're taking assessments annually and do at least a 3-year strategic plan, you can kind of prevent the surprises that may occur, both with your staff and for your organization.
Okay, great. And someone else mentioned, you mentioned the health resources, that they could take care of that. So are a lot of these models for larger organizations, or can they also be applied to small health centers?
Oh, absolutely. It's not a one size fits all, but it's customized for both small organizations. Even your United Way often has training opportunities for the organization and the environment. Because you're a community sponsored partner, you can take advantage of those opportunities that are there as well. You know, one thing I just want to mention, you know, there are different management guru theories that have occurred, but that we've seen throughout the years. And when we toss out names such as Peter Drucker or Mintzberg, you know, some of the earlier ones were more I and more self, such as Thale and Taylor and McElvey. Those are the ones that we don't want to emulate, because our organization is a living, breathing organization that depends on every individual that's employed. So it's really a team approach, so that when we want to recognize or reward or bring up individuals who may be having a little lag, we want to bear in mind that this is an entire organization that we're trying to move forward. So we have to denounce those earlier management theorists that felt that it was a control, a command and control, or self-centered, but no longer is that the case. The organization is the people and staff that make it up.
Yeah, excellent information. And so moving to another set of questions is, how do you deal with resistant staff? So someone mentioned that their CEO is extremely uncomfortable with change, and he kind of sets up roadblocks against progress for implementing changes. Do you have any recommendations to deal with a situation such as this?
Yeah, sure. There's a little list that is quite helpful, even if the senior management is not on board to the flexibility theory. The immediate supervisors or managers can certainly take up the banner, but one, you want to let staff persons know that they're appreciated, that you value. I think in presentations we now have been instructed that you never point your finger at the audience, but you may use a closed hand, but you never point. So just in that paralleling with staff persons, we never want to point out the inadequacies without giving another recommendation of how to improve. So we want to let our staff know that they're appreciated. We want to provide employee perks that help to relax the atmosphere, even if it's in an organization where the CEO, because there are so many other things that individual has to be mindful of, and sometimes is not as fully aware as the organization with the staff that make up the organization. But you want to have some employee perks. It can be something like Casual Friday, so that everybody kind of winds down on Friday after a hard work week. It may be, when I say Casual Friday, it could be a company t-shirt that everyone wears on Friday, and it symbolizes, a team approach, but it also relaxes you in nature. It could even be lunches, whether it's potluck lunch that occurs on Friday during lunchtime, or if there's an opportunity to have a catered lunch, so that you're demonstrating appreciation and providing some perks. And there's also some other incentives that I talked about, not only monetary, but other incentives. Maybe it's a blue ribbon, a certain department, because they've really excelled over the last 6 months and you've been keeping track, whether it's with quality indicators. You've been able to have your health education team really work on diabetic classes or hypertensive classes, and through your sampling pool you've been able to demonstrate that you've been able to lower and bring down hypertensive numbers, which also turns into pay for performance, because there's a reimbursable rate that goes along with patient-centered medical home. So then you acknowledge that department, say with a special lunch or gift cards, as I mentioned earlier, $10 gift card to the movie, or even just a handwritten note that maybe your managers can get up on the desk of the CEO so that it's written off by the CEO. That means a lot, because it's brought to the attention of the CEO, who otherwise may have thoughts and is busy about the entire organization. But having that sign-off means a lot. And then again, understanding the work environment can greatly affect the employee morale, such as, for example, brightening up the space, workspace. Sometimes it's a picture frame of a flower pot or some colors. If there's no natural lighting in a particular area, maybe there's some other means to brighten so that there's a feeling of emotional well-being also. And another tool is 360-degree feedback surveys. That's where you illustrate what the employees support and encourage them so that there's a continual improvement and dedication to improving the work, meaning that you're providing a survey, and that's another tool, 360 surveys, that you're getting the holistic approach. Not just are they able to do the job task, but how an individual feels about the department that they're in or the space that they work out of. Yeah. And then, of course, you want to encourage communication between employees and management, both verbal communication, be it email, but that there's some constant communication, and even if it's just sidebar communication, it also helps to relax and improve the productivity of staff or individual. And even if it means revising your company mission and statement, your value system, but that you're taking in consideration, say it may be a survey box or a comment box that you have throughout the organization where employees feel comfortable and free to drop a line about whether or not our value or our mission statement really reflects the tone of the organization. But I say be mindful that if you put these boxes out and there's comments that are there that you want to react on them, not just have it there for show, because staff will all then start to feel that there's this black hole that they don't matter. And of course I talked about loyalty, making sure that it's both ways, and giving employees to have a chance to help each other. For example, if someone has an illness that has caused them to miss a number of days from work and they've exhausted their leave time, is there an opportunity to have a sick bank so that other employees can donate time to their colleague in their time of need? So just a lot of small different ways can demonstrate that the organization that they've chosen to work with, that has mutually chosen to enter into this agreement of function and task, is being respected and valued.
Yeah, thank you so much for that, Karen. And as you mentioned with creating a more productive and engaging space, we did have a webinar, I guess, a couple weeks ago with Cindy Barr from Capital Link about optimizing clinical environments and how that will also increase productivity. So that's something else attendees can also access from our webpage. Another question is, when a manager is underperforming and is hampering staff development, what corrective measures should be taken?
Well, and there again, hopefully that if communication is flowing between the manager and the staff person, that will lend itself to an awareness, and if an awareness, an opportunity for correcting or guiding to a different direction or a different focus, but engage in new ideas so that it's not an attack on, and there again we have to be careful and mindful that, as I said earlier, when individuals leave a company, they usually don't leave the company because of the mission, because that's what drew them to the organization to begin with. But oftentimes an individual leaves because of the manager or the immediate supervisor, that there was some challenge there. So if indeed that occurs in, say, a human resource department is not a place where or has not progressed to engage activities that can reconcile this, having the individual, the staff person, offer creative suggestions across the department so that the management actually feel that there is staff within that department that can help move and be productive, which ultimately allows the manager to shine. So I say offer creative and suggestive ways if there's not a human resource process in place to intervene, but never attack, but offer solutions to the challenge.
Yeah. That's very good information. And one of our last questions is, should contractual, volunteers, and other affiliated staff be included in trainings and changes to the workplace culture?
Oh, absolutely. Oftentimes, we have a separation. Now, of course, there are benefits that go along with an employee. There are certain privileges that go along with that. But if we have volunteers in the organization or a contracted staff person, we want to tap into those resources of thought that they have as well. They have eyes and they see things that happen within the organization as well. So we want to tap into that resource and not let that resource walk out the door untapped. There may be different forums that we have with volunteers, such as volunteer training, or we offer special meetings for volunteers, or if they're contract employees, we have a newsletter on relationships with contracted employees and the organization. But the idea is that you're making each sect feel valued and a part and not alienated or feeling separate. As I mentioned, certainly there are different privileges that go along with being employed, but yet each of the persons that enter into that workplace become a part of the living, breathing organization and have thoughts and opinions of which we would value, and we'd be remiss if we did not tap into those thoughts and ideas that each of those individuals have. But how we receive that, there are so many numerous ways that we can do that.
Mm-hmm. Great. Well, Karen, thank you so much again for presenting during this webinar. That is the end of the Q&A session, and I would like to remind all attendees once again that the information was recorded and will be made available through our website as well as through an email that will be sent in approximately 48 hours after the end of this webinar for resources in the slides. So I just thank everyone for joining us today, and tune in tomorrow for our next webinar on outreach with TCA Health Center from Chicago. So they'll be featuring a lot of the information and strategies they use during their outreach and enrollment phase. All right, thanks.
Thank you.
All right, bye.
Bye-bye.